Ulcerative colitis. It's a condition that affects nearly 1 million people in the US alone. But for anyone who actually lives with it, it is so much more than just a statistic. It's a daily and often completely invisible journey. So let's dive into this and really explore the science, the treatments, and, most importantly, the incredible hope that's on the horizon. You can really think about this as a story in 3 parts. First, it's a chronic disease, something that requires lifelong management. Second, it's an unseen battle that goes way beyond just the physical symptoms. And third, it's a powerful story of hope, one that's being driven by some truly remarkable medical progress. We're going to touch on all 3 of these today. Okay, first things first. Let's clear up something that gets a lot of people confused. Ulcerative colitis, or UC, versus Crohn's disease. Now, they're both types of inflammatory bowel disease, or IBD, but they are not the same thing. With UC, the inflammation is continuous. It's one long stretch, and it's only in the innermost lining of the colon. But Crohn's? That's a different story. It can create these patchy areas of inflammation pretty much anywhere in the GI tract, and it can go much deeper, affecting all the layers of the bowel wall. So now that we've made that distinction, let's get to the heart of it. What exactly is ulcerative colitis, and how did doctors figure out for sure that that's what's going on?
Here's the official definition for you. It's a chronic IBD that causes inflammation and ulcers, specifically in that inner lining of the large intestine and rectum. The 2 big keywords here are chronic, meaning this is a long-term thing, and innermost lining, which, like we just talked about, is that key difference from Crohn's.
Getting a diagnosis isn't about just one single test. It's more like putting together a puzzle. Doctors look at a patient's clinical symptoms, sure, but they combine that with evidence from an endoscopy. That's a tiny camera that looks inside the colon for that continuous inflammation. And something called histology, where a specialist takes a close look at tissue samples under a microscope to find the absolute telltale signs of the disease. Okay, so once that diagnosis is confirmed, the treatment journey begins. And honestly, a really great way to think about this is like climbing a ladder. You start with the foundational stuff, and then you move up to more advanced options if and when you need them. So this treatment path, it usually kicks off with what we call foundational meds, like 5-ASAs. If those aren't quite cutting it during a flare-up, doctors might bring in some short-term steroids. If the disease is more persistent, the next step up could be immunomodulators. These are drugs that kind of tweak the immune system's activity. And then for those moderate to severe cases, the big goal is often to get to the very top of this ladder, biologics. Let's start on that bottom rung. We're talking about the 5-ASA drugs, and mesalamine is a super common one. They work by tackling the inflammation directly in the colon. And for a lot of people with mild to moderate UC, this is the very first line of defense. But what happens when that's not enough? Well, a patient might need steroids, but here's the thing. The goal is always to use them for as short a time as possible. If someone becomes steroid dependent, which means they just can't stop taking them without the disease flaring right back up, that's a huge red flag. It's a clear signal that it is time to climb higher up that treatment ladder. That's why you'll hear doctors say steroids are a bridge, not a destination. And that brings us to the top of the ladder, to an area of treatment that has been absolutely revolutionized in recent years: biologic therapies. See, unlike steroids, which kind of take a broad shotgun approach to suppressing the immune system, biologics are incredibly precise. They are literally engineered to go in and find and neutralize the very specific proteins or cells that are causing all the inflammation in the first place. It's a much, much more targeted approach. One of the first and still one of the most common types of biologics are the TNF inhibitors. Now, TNF-alpha is a protein that basically acts like an alarm bell for inflammation. These drugs go in and block it. And I love this analogy. It's like finding all the faulty fire alarms in your body that are screaming, "Fire!" and just silencing them. Here are a few of the workhorses in this class. You might even recognize some of these names like infliximab, adalimumab, and golimumab. As you can see, they're given either through an IV infusion or as a pretty simple injection under the skin, kind of like how someone with diabetes would take insulin. But of course, the innovation didn't stop there. Newer biologics, like vitalizumab, work in a totally different way. It's called an integrin inhibitor. So instead of silencing the alarm, this drug acts more like a bouncer at a club. It specifically blocks inflammatory cells from getting into the gut tissue. By basically revoking their access pass, it keeps the inflammation from ever starting, which can mean fewer side effects in the rest of the body. Pretty clever, right? So what does success actually look like with these drugs? Well, this is real-world data for another biologic, ustekinumab.
In a study with patients who had really difficult to treat UC, about 1/3 of them achieved steroid-free remission. Now think about that. For someone who is completely dependent on steroids, getting off them entirely and feeling well, that is an absolutely life-changing outcome.
But managing UC isn't just about getting the physical inflammation under control. There's a whole other side to this disease that we're only now really starting to appreciate and address properly. The physical symptoms, those are the things we can see and measure. But what about that unseen battle? What about the mental and emotional toll of living day in and day out with an illness that's chronic and so unpredictable? This quote from an expert consensus statement just says it all. It is a two-way street. It's not just that living with UC can affect your mental health. We now know that anxiety and depression can actually drive inflammation, which can make the disease itself worse. It can become this really vicious cycle. Because this connection is so powerful, experts are now saying it loud and clear. Mental health care has to be part of IBD care, period. And that means doctors need to be initiating conversations about emotional well-being, they need to be routinely screening their patients for anxiety and depression, and they need to be encouraging them to get evidence-based psychological support. Okay, so this brings us to the final, and I think the most exciting part of our story, the future. How are scientists pushing the boundaries right now to help even more people find relief? For a long time in this field, doctors talked about something called a therapeutic ceiling. It meant that even with all the great medications they had, there was always this group of patients who just didn't respond. It left them with very, very few options. So the goal now is to smash right through that ceiling. And this is one of the drugs that's doing it. Guselkumab is a monoclonal antibody, which is just a fancy way of saying it's a lab-made protein that's designed to hunt down one very specific thing in the immune system. In this case, it targets something called IL-23. You can think of IL-23 as a messenger protein that tells the immune system to attack. So by blocking IL-23, this drug quiets that signal down. Its recent FDA approval for UC is a huge deal because it gives a brand new option to patients who might have already tried and failed other therapies. This quote from Dr. David Rubin, who was a lead researcher on the study, it just perfectly captures the feeling in the medical community. Every single new, effective option means another chance for another patient to find the exact right treatment that works for them. And at the end of the day, more options mean more hope. And this leaves us with a pretty fascinating thought to end on. We've gone from these really broad treatments to incredibly targeted therapies. So what's the next logical step? Well, it's personalized medicine. What if, one day, we could know from the very beginning which one of these amazing options is the absolute perfect fit for each individual patient? That is the hopeful future we're all moving towards.